go. All right, welcome to the September Comagine Health Patient Family Partnership Hub meeting. I'm excited to be with you all here today. As a reminder, I'm Lindsay Galley. I'm the Vice President of Programs at PFCC Partners. I'll introduce our organization shortly. I have taken over facilitating this amazing community from Laura Jackson, who has been doing it for the past couple of months. Laura is still on the PFCC Partners team. She is just focusing a lot more on our national network, the PFA network. But I am thrilled to step back into facilitating the hub and all of the activities that we have going on today and through the rest of the year and beyond. So just a reminder for some Zoom features and a reminder for me to turn on captions for everyone. All right. Save, there we go. Okay. So we'll have lots of time for discussion today. So it looks like all of you have been able to come off mute and speak up. There is also the raise hand button that we appreciate everyone using once we get to those discussions. If you have a question or a comment or anything to share, you can find that by clicking the reactions button on your Zoom toolbar and then clicking raise hand, and that will just let us know that you would like to come off mute. And then please use the chat box for any other comments or questions that you have. We'll monitor that as well. All right, so this is the Comagine Health Patient Family Partnership Hub. Comagine Health's mission is, together with our partners, including all of you, patients, families, and the community, we work to improve health and create a better healthcare system so that people and communities will flourish. And we have a few Comagine Health partners on, but our main partner from Comagine Health, Katie Frazier, is on. So hi, Katie. Good to see you.
Hi, everyone.
Thanks for joining. All right, and just a reminder, for our organization, PFCC Partners, we work really closely with Katie and other staff at Comagine Health to really bring our own vision to life, which is a health system transformed and one that works with people and through communities as a partner in their well-being. In our partnership with Comagine Health, we bring all of these values, which include equity, inclusion, diversity, collaboration, and solution focus, which we'll actually talk about that last one a little bit today when we talk about the core competencies. And this is the Patient Family Partnership Hub. This is the monthly meeting of the Patient Family Partnership Hub, but there are a lot of other activities to jump into. We're really aiming to create a community of patients, families, and community members who are all, really driven forward with the same mission to improve healthcare, specifically through the Comagine Health states and the work that Comagine Health is doing. So we are here to support existing advisory councils across Comagine Health, including the ESRD Advisory Council and the Utah Advisory Council as well. Outside of Comagine Health, we host a lot of patient-family-centered care events, monthly workshops, lots going on that is absolutely available to all of you, as well as skills development opportunities or skills exchanges, which we'll talk about in today's session as well. And then, of course, just fostering this community. We do have an online forum, which I'll share in follow-up to those who are new. I would love to continue to start some conversations there and just be able to communicate in between these meetings. So more to come on that. And then, of course, engagement opportunities. And we have a loop to close with all of you. With a few of our other Comagine Health partners on. Alex here to talk about the hospital utilization listening sessions that took place over the summer and new opportunities to come as well. All right, so here are our agreements that we have laid out way in the beginning. We'll continue to open these meetings 10 minutes prior to start, just for anybody who wants to jump on early and chat. Joanne and I had a great conversation and Jan jumped in. So just if you would like to connect prior to the meeting, we'll leave that time. Let's see, I think we provided some context for our discussion for today. I actually do have discussion questions, and apologies for not sending them out prior, but we'll have a lot of time for that today for you all to think through. And then please, again, using the raise hand button, we are recording this meeting and we'll share out summary for anybody who wasn't able to join after. All right, so let's jump into our agenda for today. Like I had mentioned, we have Alex Topper joining us from Comagine Health to talk about the hospital utilization listening sessions that some of you participated in. And she'll walk through that in the form of a milestone moments tool or template that we had shared out with everyone prior. So excited to share that tool and then hear from Alex. We have an upcoming core competencies of effective partners skills exchange that we're offering to the PFA network. But we are going to highlight Comagine Health and the work that's being done here through the skills exchange. So we'll have a conversation about, you know, what skills you use to be a really effective partner, and how we might be able to translate that into the skills exchange coming up next month. And then we have a new opportunity to share. The Northwest Patient Safety Conference is coming up, and they have a virtual option and it is free to register. So we'll share information about that as well. All right, let's do a quick round robin. Would love to hear who you are, where you're from, and if you could learn one new personal skill, what would it be? I'm Lindsay Callie. Again, I'm actually located in Sacramento, California. Our office is down in Long Beach. And I think one new skill I would love to learn is how to surf. I tried it once actually when I was in Maui for my honeymoon, and we were talking about Maui, and I was terrible at it. I did better than my husband, but it would be amazing to be able to be really good at surfing. So I'll go through my list here. Joanne.
Well, the thing I do that I wish I did better, I guess that's the best way to put it, is find more ways to create opportunities to interact with patients, potential donors. Bellingham is not a big city, to say the least, and there's only one dialysis center, so we're very limited. I lived in Seattle before and worked through Swedish Hospital, you know, and there were plenty of people to talk to and plenty of opportunities and events and stuff. So I'm hoping to see more of that now that COVID is not settling down. We hope. We don't know. They're wearing masks again up here, but I want to be able to touch more people. And I don't know where I fit in to do that. I think about the senior center and people go, oh, you can crochet, you can. I go, no, thank you. That's not my thing. You know, I've done crossword puzzles my whole life and read, and that's it. So I don't have an outside interest because I always worked at home.
Yeah.
So COVID didn't bother me in that sense because I was used to working from home anyway, and I kept working. So but
well,
that would be
Oh, you find community here virtually, and getting back in person too. That's awesome.
And I'd like to do that virtual if my computer would behave and quit rebooting itself and updating because I don't use it enough. I could certainly help somebody, you know, or listen to somebody. And that's what I do for my family. I have an aging group right now, of which I'm one of those. And they need an ear to listen. It doesn't have to be kidneys. It can be anything. Just the opportunities to listen to people and their fears can give you more ideas on how you might help somebody.
Absolutely. I really like that. Thanks, Joanne. How about Jan?
Hi, Jan Lambert in Salt Lake City, Utah. And I would really like to be able to speak better in front of groups. And I get so nervous and so scared. It's so painful for me. So that I think I could be a better advocate and you know, if I could do that without having a trauma every time.
Right.
Anyway.
That's a hard skill, Jan. But I know that there's resources and people out there who can help. Yeah, that's tough. That's not easy. My dad actually, he was a patient family advisor one time when I was just getting started, and I didn't realize how big of a fear he had of public speaking. And I was like, oh my gosh, I'm so sorry. It's a real fear for people. So yeah, it's a lot to work through. All right. Thanks, Jan. Lisa.
Well, my name is Lisa Custer, and I'm in Beaverton, Oregon. And I guess if there was one new personal skill, I actually just was hired by Next Stage Medical 2 days ago. It is a patient advocacy. It's a compensated position, and uh, right off the bat, I trained PD, the manual, the cycler, as well as home hemo. Right out of the gate, I had four patients. No, I did. I had four patients, five family members, 9 people in total. I'm an excellent speaker. That's an easy part. What's difficult for me is that I had to walk into a PowerPoint spreadsheet. I had 5 minutes to prepare from this position, and I only have a tablet, and so I have to admit I have my strengths are such, but when it comes to the computer, it's like, ugh.
Yeah.
Only because in my 37 years in the financial industry, I had a staff. I didn't have to do anything.
Right.
That
Yeah.
my management position warranted, uh, just field it off. And so I hadn't been working for 9 years. I did retire before I got kidney disease at 50. And here I am and I didn't even apply for this job. I was nominated by 2 different centers. And so that's the only way you can get in next stage. So my responsibility is for all of the patients in center for the entire state of Oregon.
Mm-hmm.
And so the next stage is, believe it or not, is limited in being able to have access, but we do have access. And so where I went was on the in-center side of my my home office, and I've known them for years. I've been independent for 10. Okay, I don't want a transplant. I'm not going to be open up like a fish.
Mm-hmm.
I'm a native. Culturally and religiously, it's against my. It's just it's off the table, and I'm much more healthier than a lot of transplanted patients that I know. So that goes without saying. So yeah, I would have to say that 2 days ago that was a struggle that I had to deal with live on a first day on the
Right.
job.
Yeah.
And I'm never I I'm always prepared, and fortunately I know the subject content first matter on the manual, the PD, and all that. But it was 9 years of recollection because mind you, I've been on home hemo for that long. So yeah, that was kind of a tense moment. But we got all four patients on board. We got all the family
Amazing.
members on board. And I was very, very happy that I had in real time impact on being able to bring not only the knowledge, but the hope and the look on these people. It was just like going back 9 years.
Yeah,
And
that's
and the fam
amazing.
and the family members, and mind you, of course, my husband died 2 years ago as a caregiver, and I
Right,
had to talk about some difficult subjects. And
right,
fortunately, I had a family member that came forward after the respite care. But how often does that happen? Well, that happens lesser than 1%.
right.
And so that's why, you see people going back to the center, either if they're non-compliant or, if they're tired, and mostly it's caregiver burnout. And that issue needs to certainly be addressed. And I just happen to
Yeah,
have my cousin waiting. He just came in the room, just happened to hear the subject, and bless his heart, he's a very quiet man, but he just chimed in because he's seen parents, significant others really trying to grasp on. And
yeah,
he heard that, and he just kind of made it a moment, just a small moment too, to just reassure people. And I would have to say that my primary passion is being able to get people independent. Should they, and mind you, because I am with the ESRD network and I am with the
yeah,
NCC Pac, it is so important that we have the opportunity to give people options. And
right.
a lot
Thank
of
you,
our
Lisa.
yeah, thank you.
Sorry, we have a few more introductions to get through, but I love that you brought up the family caregiver, and I think that let's put that on the parking lot because I want to bring that up at our next hub meeting and talk more about that role. I think that would be really interesting discussion in all of this work that we're doing. Thank you. Let's go to Joan. Oh, Joan, you're muted.
I'm Joan Gallegos. I had it muted. My dogs are barking at the UPS man out there. So forgive me. But I'm with the Utah office. I'm a consultant and I do their patient family advisory council. And the skill I'd like to know better is technology. And just, I wish I was a wizard at it. But I
Yeah,
think it's partly my age. And but there's so much I wish I knew.
yeah.
Thank
And
you.
there's so much that keeps changing too. So
Yeah,
hard to
thank
keep
you.
up with. Thanks, Joan. Katie.
Hi, everyone. I'm Katie Frazier. I'm an IT project manager at Comagine Health, and I'm located in Portland, Oregon. And a skill that I wish I could learn or be better at is meditation. I am not successful. I get 10 seconds in and my mind is going somewhere else. So that's one thing I envy of others.
Yep, that's hard to do. I was just trying to do yoga a little bit earlier and just breathe, and even that was hard just to relax. Thanks, Katie. All right, we'll move on to our guests today. Alberta and Alex, would you both like to introduce yourself, and then you can just kind of take it away.
Awesome. Thank you, Lindsay, and thank you everybody for having us here today. I see a couple of familiar faces and a couple of new ones. My name is Alex Topper. I'm an improvement advisor at Comagine. I'm working on our Medicare contract, so I'll talk a little bit more about what that means and what I'm working on during my presentation. And I'm joined by my teammate, Alberta Davis, if you want to pop off mute and say hi. And I'm located in Vancouver, Washington, so right outside of Portland.
Hello, everyone. I'm Alberta Davis. I'm an improvement advisor here at Comagine Health. And for now, I'm Alex's sidekick.
Yes, Alberta is new to our team, so she's learning all about the work we're doing, particularly with the PFA network. So we're excited to have her on our team. You might remember.
Oh, sorry. Go ahead.
I was just going to say, if you remember our teammate Seema, maybe you remember the name Seema. She's our other team member, but she's not available today.
Awesome. Yeah, I told you to take it away, but I was going to introduce the milestone moments template first and then pass it over to you. So at PFCC Partners, and actually, in our collaboration with Comagine Health, we have been talking for a while about how to capture the amazing partnerships that are happening. And I want to say quote unquote successes, but sometimes seeing success in patient family engagement can be really hard because it comes like years later. So we decided to create a tool and a tool to capture, and I'm going to bring it up on the screen over here, a tool to capture milestones in patient family engagement. Because there are milestones, like even when a healthcare team has that first conversation with a patient or a family caregiver and they hear the perspectives and the stories, like that's a big moment for that healthcare team. So we've created this template for healthcare teams and patient family advisors like all of you to use to capture your own milestone moment. So I shared this, we shared it in the reminder, but I will put the link to this in the chat as well and welcome you to take a look. And if you would like to use it to put your own kind of milestone moments together, you can do that. Or if you have a healthcare partner that you would like to collaborate on developing a milestone moments, you can do that as well. And please let us know if you would like to share it more broadly with Comagine Health or even our larger PFCC Partners Network. All right, now Alex, I'll pass it back to you. Take it away.
Awesome, thank you. And I see my slides, so I'm totally fine with you sharing them. I'll just say next slide. Does that sound good?
That works, yep.
All right, let me get myself situated then. Awesome, so you can go ahead onto the next slide. So I'm going to talk today about a project that some of you might have already heard of. I know at least Jan has been a participant or has been involved, and I think maybe some others that you might know through the PFA network have also been involved. So at Comagine Health, we have a care coordination team. So that team is myself, Seema, who's not here today, and Alberta, who's joined us. And we are focused on 3 measures within the Medicare space. So we're working on supporting hospitals and clinics in decreasing emergency room visits for beneficiaries, decreasing hospital utilization for beneficiaries, and decreasing hospital readmission. So getting discharged from the hospital and being readmitted to the hospital within 30 days of the discharge. So we decided that part of our work around care coordination, we wanted to understand Medicare beneficiaries' lived experiences in the healthcare system and understand how those experiences might shape our work to ultimately work towards those measures. So that is how we came up with our project, this Medicare beneficiary listening session. Next slide, please. So project summary. So as I said, we came up with this project, the beneficiary listening sessions. We hosted listening sessions for beneficiaries to better understand the barriers and successes in accessing healthcare. These sessions focused on experiences with primary care, hospitalization, and hospital discharge. All of the discussions centered around positive and negative experiences within healthcare. And the sessions, there were 3 total. They took place in February, April, and June of this year. They were 90 minutes each. We aimed to have between 4 and 6 beneficiaries in each listening session. And Lindsay, who's hosting this meeting, co-facilitated those listening sessions with us. Next slide, please. So as hopefully you're all already familiar with, Comagine and our work, but Comagine leadership is a really strong advocate for involving patient family advisors in our work. And so leadership encouraged our team to engage PFAs around this hospitalization project. So we didn't need any prior approval. We were just able to move forward with the planning. The care coordination team designed the sessions. And as I said, we partnered with Lindsay and we developed a discussion guide. So we didn't want these discussions to feel like an interview. We wanted them to feel like more of a conversation. So we developed a discussion guide that had a couple of questions that we pretty loosely followed. And then Lindsay also helped us recruit participants and host the sessions. And now that the sessions are over, we're working on writing up a formal report to share with CMS, the Centers for Medicare and Medicaid Services, the people who manage Medicare insurance, to help them understand what we learned from beneficiaries and understand how those lessons learned might impact, CMS's guidelines, the things that CMS recommends hospitals do, the services that CMS decides to cover. So that was the purpose of the whole session, to get this information to turn into a report. So next slide, please. So a little bit of information about the participants. So they all came from the PFA network. We had 9 participants total across the 3 sessions. Next slide, please. We had participants joining from a number of different states, some Comagine states and some outside of the Comagine service area. So we had California, Georgia, South Carolina, Nevada, New Mexico, Utah, and Wisconsin were all represented. And all 9 of the participants came from urban or suburban zip codes. So no very rural participants in this particular session. And we asked everybody what their most recent experience was with the healthcare system. And the answers ranged from anywhere between a week ago to 4 months ago. So pretty much every participant had had some sort of interaction with the healthcare system within the last 4 months. Next slide, please. So from these listening sessions, we basically had these long conversations and took a lot of notes about what beneficiaries pointed out, and we split them into 2 topics. So we looked at primary care and we looked at hospital use and hospital discharge. And then each of those themes, we kind of broke down by whether the experience that the beneficiary described was considered a success, so something that went well for them in the healthcare system, or if it was a barrier, so something that could have gone better or didn't go well, and they feel kind of impeded the care or the experience. So I'll start with primary care, the themes that came up across the 3 sessions in primary care. And we'll start with the successes, start on the positives. So patient-centered care was a topic that came up quite often. This was the most cited source of patient satisfaction in all 3 of the sessions. And so this was when a doctor or primary care provider engaged in shared decision-making about health goals. So the patient and the provider worked together to think about and talk about the patient's health goals and how the patient can improve their health or work towards a specific goal. And those that were happiest with their primary care providers said that their primary care providers asked a lot of open-ended questions to understand the patient's concerns, and they were supportive in supporting the patient towards their goals rather than instructive. So giving you a set of instructions that you have to follow and not a lot of opportunity to ask questions. And those that felt that they were actually involved in their own care decisions were happier with their experience. Beneficiaries also expressed that they felt that when their primary care provider genuinely cared about them and their well-being, it was a better experience. And so those that felt their providers cared more about them used words like patient, caring, good listener, thorough, so words to describe a good provider. Beneficiaries also experienced or expressed good experiences with health system integration. So they felt that there was a better continuity of their care when they were seeing a primary care provider that was in the same system as a hospital, so that if they did end up going to the hospital, there was better communication between the primary care clinic and the hospital, and it was easier to access their records. Beneficiaries also talked positively about specialists. So many beneficiaries see specialists in healthcare. The people with the greatest satisfaction were those whose specialist and primary care provider were in contact with each other. And then finally, another really positive experience centered around community resources. So beneficiaries expressed that they were all interested in referrals to some sort of community-based resource as a means to bridge gaps to care. So whether that be housing, transportation, language accommodation if English is not your preferred language, somebody to help coordinate appointments, somebody to help you understand your Medicare insurance benefits. So all of these community-based resources were really highly favored, and those beneficiaries whose primary care providers connected them to those resources or recommended resources felt like they had a better experience. So those were some of the main themes. And as I'm sure you can imagine, 3 90-minute sessions, we got a ton of information. So these are just really like the big highlights, but there were a lot more points that were made as well. And next slide, please. So continuing on to some of the barriers that a lot of beneficiaries experience in the primary care world. So first that came up quite often was difficulties establishing a primary care provider. So we heard people say things like, it's difficult to find a provider that I like. It's difficult to find a provider that has availability or that is in my area or that takes my insurance or is accepting new patients. So a lot of challenges to just establishing care. Second, another thing that came up a lot was long wait times for appointments with primary care providers. So a lot of beneficiaries felt frustrations with not being able to get into their doctor's office in what they felt like was a timely manner, especially for an emergency. Unsatisfactory patient-provider relationships. So we heard quite often, maybe people in this group have experienced, oftentimes you see a provider for a very long time. They're your doctor or your family doctor for many years. They know you, they know your family, and then they retire or leave the practice. And a lot of the times beneficiaries found that the doctor who was kind of sent to take over the practice or sort of replace the provider, they weren't necessarily really satisfied with. So they had to leave a practice that they had been seeing for quite a long time, which of course has challenges. Another very commonly cited issue, I would say probably the biggest barrier that came up, was cost and the prohibitive costs of care. So the current system, a lot of beneficiaries feel, forces the beneficiary to pick and choose which care to receive and which care to forego, knowing that most of those care options will lead to some sort of cost. And there were a lot of concerns about families inheriting medical debt or beneficiaries themselves draining their savings to pay for care. So there were a lot of concerns about cost, which I'm sure comes as no surprise to everybody in this meeting. Another issue that came up a lot was dissatisfaction with the Medicare plans. So for example, we heard a lot of people say that they think that the value-based plan is only good for patients that are generally really healthy and don't utilize a lot of services. A lot of beneficiaries felt that their providers were too caught up in billing and too caught up in what services they can bill for and be reimbursed for, and they felt that that sort of distracted from their care. Telehealth was another thing that we discussed. So a lot of beneficiaries expressed that they were not always comfortable with telehealth. They don't always have the technology that they need to complete a telehealth visit, or they had concerns about privacy or about kind of the impersonal nature of telehealth. And then a lack of attention for mental health also came up quite often. So primary care is not really asking beneficiaries very much about their mental health as a concern for beneficiaries. So that was kind of the main, I know there's a lot of information there. Those were the main points that came up about primary care and beneficiaries' experiences in primary care. So I'm going to move on next, and next slide, please, to the hospital discharge side of the conversation, which was a very, very informative discussion in all 3 sessions. So successes, so things that beneficiaries felt went well during a hospital discharge. Firstly, receiving thorough education from nurses at discharge. Some of our beneficiaries felt that their nursing team really took the time to educate them on their condition and what they should be doing once they get home and how to care for themselves to make sure that they don't wind up back in the hospital. Other beneficiaries felt that they had better outcomes with hospitalization and discharge when they had a family or caregiver present. That was a excuse me, that was a very, very common message that we heard, was that having a spouse or a friend or a child or a family member present really helped advocate for their needs and also helped them understand what they needed to do once they left the hospital to stay healthy. We also heard a lot of positive experiences with having social workers involved in the discharge process to connect patients to resources and to make sure that the patients have the appropriate follow-up scheduled. So that was a major point that I think a lot of beneficiaries felt was positive. And then comprehensive follow-ups and check-ins from the hospital after discharge. So once the beneficiary is sent home from the hospital, some hospitals that we had beneficiaries talk about or describe did a really good job of following up. A couple days later, they would check in with a phone call. A couple more days later, check in with another phone call, give them a lot of information, tell them who to ask if they have any questions. So some beneficiaries felt that they experienced a good check-ins from the hospital. Next slide, please. So now we will move to some barriers. So let's see. So firstly, we had poor experiences in the ER. So things like experiencing a long wait time to be seen, even if it's an emergency. A lot of beneficiaries experienced going to the ER and it was very overcrowded with people who they felt maybe could have been seen elsewhere, like an urgent care or primary care. A lot of people felt that when they were in the ER and they did not get admitted to the hospital, so they were seen and sent home, they felt that they were rushed out and that they didn't get very good instructions or information. The number one barrier that we found in all of our conversations was the complexity of the discharge summaries. So when patients got discharged from the hospital, they felt that the instructions that they were given by the provider for follow-up appointments, how to take care of yourself, how to manage your symptoms, what to do if your symptoms don't get better, how to take your medication properly, all of these really important ideas, they felt were just too complicated. The discharge instructions were too long, the language was too complex. Maybe it didn't highlight clear next steps for the individual. So they felt we heard a lot of things like, I was handed this thick stack of paper with no other education or training or information, which can be really challenging, of course, when you're leaving the hospital. Then we heard, again, lack of education. So, being handed these discharge instructions, but no one's really explaining your next steps, your medications. They felt that they were really just kind of being pushed out the door. That was quite wording that we heard quite often. And a lack of standardization. So from our end, from Comagine's end, we want hospitals to have a clear, standardized process that they follow when they're discharging a patient to keep things standardized and easy and hopefully efficient. But a lot of our beneficiaries reported that they felt that staff did not follow any sort of standardized process. They felt like there should be, they should help schedule follow-up. They should make sure that the patients actually understand the discharge instructions, connect them to social workers, and they felt like a lot of those things were not happening. Next, we have poor integration of records across the health systems. So it felt for a lot of beneficiaries that there was no clear communication between the hospital and the primary care provider. And this was one part of this project that we really wanted to understand, was that if a patient goes to the hospital, in the ideal world, their primary care provider would be made aware of that so that they could then be proactive and do a lot of the follow-up that might be necessary when you're being discharged. But a lot of beneficiaries felt that that exchange of information was not happening until the beneficiary themselves got in touch with the primary care provider and let them know. And that was kind of a disappointing experience. And then finally, this one kind of goes without saying, for anybody, and maybe even especially for beneficiaries or just for everybody, hospitalization can be really traumatizing. A lot of our beneficiaries said that, to no one's surprise, they were not in their best state of mind to receive complicated health information when they were in the hospital. So again, even if the hospitals were doing a perfect job explaining the instructions and the follow-up. You know, sometimes you're so caught up and so concerned with just feeling good enough to get out of the hospital that you're not really able to focus on the information. And then you leave the hospital and all the information leaves your head, or you learned a million things and you can't keep them straight, which is totally understandable when you're going through something really difficult like a hospitalization. So those were kind of the major barriers that we heard beneficiaries say that they kind of experienced. So again, I know I just provided a lot of information, but those were the main points. And next slide, please. So what is our hope for this work? So what was kind of our goal with partnering with the PFA networks and getting this work off the ground? So without the willingness of all of the PFA partners to share about their lived experiences, this project, of course, would not be possible. We're really hoping that our report that we write that summarizes all of these findings and also makes recommendations for correcting some of these errors will be received well by CMS, and that it might shape the future work for Medicare and for Comagine. We also really hope to amplify the voices of Medicare beneficiaries and their families and caregivers. We feel that all of this work should always be integrating your experiences and your voices to best serve you, and instead of just coming up with what Medicare thinks is a good idea. So we're really hoping that this project can provide sort of a direct line of communication between beneficiaries and CMS, which is unfortunately quite rare. It's very hard to find yourself in a situation where you're speaking directly to CMS. And we're hoping that it affects positive change in the healthcare system and leaves its participants feeling seen, heard, and empowered. Next slide. So finally, what are our goals and our next steps for this work? So as I shared, we'll be compiling the findings of this project into a formal report for CMS. We have started working on the first draft. It is a very large document because there's a lot of information. But we hope to use this report to highlight experiences of beneficiaries and then hope that it influences the next scope of work for quality improvement and where these hospitals really need to focus their efforts to improve. We also will be making presentations. This is one example of a presentation, but we'll be making some others to highlight these experiences and make recommendations for other stakeholders in healthcare. So we have a lot of partners that are hospital leadership or clinic leadership. So by sharing this information with them, we hope that that helps them understand areas that they could maybe improve. And then finally, we are starting to plan a similar set of listening sessions for Medicare beneficiary family members and caregivers, because we want to understand their unique experience and challenge in supporting their loved ones through the healthcare system. So we hope to host those sessions similarly to the beneficiary sessions, and also write a report and present to the hub in the future. So that's kind of the next step for this work, the immediate next step. And I think that's all I have. I think the next slide is just contact information. So that's really the very boiled down version of, again, really rich, really interesting, just fascinating conversations, and just hearing directly from beneficiaries is really refreshing. I think we hear a lot from CMS about what they think the problem is and what they think we need to work on, but hearing from actual beneficiaries has really been the most, I think, rewarding part of this project. And so we had, you know, I hate to hear about these challenges and how difficult it can be to access the healthcare system, but we really genuinely enjoyed the conversations and look forward to engaging with family members and learning from them as well.
Awesome. Thank you so much, Alex, for sharing all of that. And listening to these experiences too, and being able to share them back. And I think we'll look forward to hearing more even in the future, you know, as this work informs CMS. So it's amazing to be a part of it. I think we have just a few minutes for questions before we have a few other topics to get to. So any one or two questions for Alex? No. All right. Well, more to come. You did see that we will be supporting Alex and Seema, now Alberta to do the family caregiver listening session. So Lisa, in line with what you were talking about, listening to the family caregiver's perspective as well. So more to come on that as we start to plan for those. And we'll definitely let you all know. Those are happening.
Excellent. Thank you so much for having us. I think we're both going to hop off to get prepared for the rest of our day. But as you see my contact information there, if anyone ever thinks of any questions or has any ideas, you know how to get in touch. We are very open to it. Thank you.
Perfect. Thank you, Alex. And we'll share that your contact information and follow up too if people want to get in touch.
Excellent. Thank you, everybody.
Thank you.
Bye-bye.
Good stuff. All right. It's always good to see, you know, how your perspectives are being implemented into the work. And I think there's still a lot more to come with the work that they're doing, but really exciting to see either way. Oh, excuse me. All right. So in our last 10 minutes or so, excuse me. Oh, I got a little tickle there. I did plan for a larger discussion, but I think we'll just stick to kind of sharing this and then hold the discussion for our next meeting. We have the core competencies of effective partners. This is a skills exchange that we present to new and experienced patient family advisors. It's a two-part online skills exchange that's happening October 11th and 18th. And again, this is open for our national network of patient family advisors, but we're really focusing on what's been going on at Comagine Health and would love to highlight some of the work that you all are doing and how some of these competencies have come into play in your partnerships with Comagine Health, or would just love to highlight you as patient family advisors at Comagine Health to share your own experiences to help highlight these skills that are really effective to be an effective partner. So really quickly, I'll describe the core competencies for those that this is relatively new to. And then we can have a larger discussion on our next meeting, because our next meeting falls on, I think, the week before this, so we can talk a little bit more. But essentially, these competencies or skills were developed by patient family advisors who were, you know, partnering for a long time without like a definitive role as to what they were doing, but found that these were the skills that helped them really get far in their partnerships with their healthcare partners. So it actually starts at the bottom with establishing partnerships and presenting ourselves as a partner to those in healthcare, you know, as a resource to support them in the work that they're doing, because, you know, the perspective of patients and families is essential to create improvements in healthcare that we all want to see. You know, we share that common mission of ensuring that healthcare delivery is what we all want. So presenting ourselves as that partner in healthcare improvement. And then we move on to constructive collaboration. I know a lot of you have been on teams and have worked in teams with other patient family advisors and healthcare partners. And collaboration can be difficult, but as a patient family advisor especially, it's essential for us to ensure that, you know, our voice is heard in those collaborations, and that everyone, including our healthcare partners, including the voices of patients and families, are part of that decision-making or co-creation process when we're getting to a solution. So being really constructive in how we collaborate with one another and with healthcare partners. And then there's solution focused, and that's pretty simply remaining focused on the solution that's ahead of us. I think sometimes, especially those who have, you know, newer experiences in healthcare or more traumatic experiences in healthcare, it can be hard, or it's more easy to really lean back on the challenges that we've experienced, some of those traumatic events, things that, you know, haven't gone well in healthcare, which we all know happens. But as a patient family advisor, it's really to move past those events, recognizing them, but then focus on the solutions. Okay, this happened to me, but how can we move forward in a constructive way and look for solutions to what happened so that doesn't happen to other patients or family caregivers. At the center and the core is having a representative voice. So acknowledging that, you know, all of you here as patient family advisors, you're representing patients and family caregivers from your states who share similar diagnoses with you, who have experienced similar challenges. So just having that acknowledgement that you are representing them as well in your partnerships as a patient family advisor. And then finally at the top is teachable spirit, just recognizing that there is so much that we can learn from our healthcare partners, but also so much that we can teach from our own personal experiences as well. So creating this all teach, all learn partnership when we are presented with these opportunities to work really closely with our healthcare partners. So in the two-part skills exchange, we dive really deep into each one of these competencies, giving examples, doing activities online. So without going too deep into the discussion questions I had, I'm just first curious if anyone would be interested and available to join and maybe share some experiences that are relevant to these core competencies, either by a raise of hand or in the chat or coming off to say yes. Lisa, I see you.
I'm in treatment, that's why, and I'm just ending.
Oh, okay, perfect. All good. But we'll keep you in mind for this as well, and we'll talk more about it on our next meeting. Any others? Joanne, I see. Jan, I know you're always up for always up for something. So. Okay, well, we can kind of touch base before this. I will, in follow-up, send out the information about registering, and then I'll just give you a few questions just to kind of think about, and then we can think through how to integrate them through this two-part series in October and talk more about it on the next meeting. Right. So more to come. Sorry, I'm going to go through. All right. And then as we wrap up, just a couple events and reminders. On September 17th, it is actually World Patient Safety Day. And this year they are kicking off with a focus on patient-family engagement, which is really exciting. So really looking to how engaging patients and family caregivers comes into play when it comes to providing safe care. And I think it's amazing because, you know, when patients are engaged at the bedside, that is key to safety. You know, family caregivers as well, they know everything there is most of the time about those patients. So engaging them in providing that safe care. And then in creating processes that are safe in our healthcare system. So I'm really excited that they're focusing on patient-family engagement this year. Through the PFA network, we are creating a word cloud, and we just want to hear from you. We want to know, you know, what's important to you for improving patient safety from the patient and family caregiver, beneficiary, community member perspective. So I have, this is a link. And I will share it with you, but I think I can open it just to show you what it looks like. Give me just a second. So what we're looking for is just 3 words, the priorities you have for improving patient safety. So, you know, in other contracts, we talk a lot about sepsis. So that could be one word, you know, being engaged in ensuring safe sepsis care and things like that. So it's hard to think of one word, but we're creating a beautiful word cloud that we'll share back with you and our healthcare partners and everyone else to promote World Patient Safety Day. So I'll send this link in follow-up as well, but I will also put it in the chat. Let me get a little prompt here. Patient Safety Word Cloud link. Here we go. but I will send that in follow-up and would just love to see your words highlighted. Okay, and then finally, this was mentioned in the agenda, but just wanted to promote, and we'll remind folks again at the next meeting and before then, but the Northwest Patient Safety Conference, we have a theme here with safety, is happening on October 17th and 18th. It is virtual and it is of no cost for patient family partners or patients and family caregivers. This year you can see, and I'll send the link to the actual conference site that has more information about the agenda and topics there. But it focuses on solutions to problems rather than the problems themselves. So solution focused, just like we were talking about. And really focusing on, you know, what's worked in patient safety, what hasn't, and what to do about it. But we wanted to share this with all of you, knowing that a lot of the Comagine Health states are in the Northwest region. So we'll share the website for this conference and the registration link out in follow-up as well. Yes, bunch of good stuff going on around here. All right, any questions about anything we talked about today or the opportunities coming up?
Nope, no questions.
A lot of good stuff going on. So we'll be in touch after with all the links to the resources and everything.
Thank you, Lindsay. Thanks.
Absolutely.
Thanks, Lindsay.
Yeah. Good stuff. All right. Well, thank you all for joining. I appreciate you taking the time and joining this meeting today. And again, yeah, lots of follow-up to get out to you. I think I'm going to send the word cloud right after this meeting, just so you have that link. And then the full follow-up will come out next week with all the links to everything we talked about. So more to come as always.
Right.
Okay.
Great. Well, thanks everyone. Have a great rest of your week and a good weekend.
Bye.
Bye-bye.
Thank you. Bye-bye.
Bye, everybody.